Andarki namaskaram. Hi everyone. So in this beautiful day, we are here to do a podcast and important discussion to create awareness with our pioneer, Dr. Sibasankar Dalai sir, the Chief of Neuro Intervention and Vascular Department in Visakhapatnam Medicover Hospitals. I, Dr. M. Srujna Devi, Consultant Anesthesia, Medical Superintendent, Medicover Hospitals, Visakhapatnam. Every minute counts. So why this theme we are going to discuss now. So what is stroke? So according to us, stroke means it is something which is a blockage or any rupture for the blood supply to the brain. The blood supply which is going from the heart to the brain with arteries like the carotid arteries on the both sides of neck and the vertebral arteries. In the circle of arteries in the brain, there is some blockage over there. Due to that lack of blood supply, there is no oxygen being supplied to that areas and the brain cells over there are going to die. For every 1 minute of attack, for every 1 minute of acute stroke, there are around 1.5 to 1.9 million neurons being dead there, so that areas being affected, including like muscle control and speech areas. So here we are seeing two different types of strokes like ischemic stroke and hemorrhagic stroke. In that, ischemic stroke is around 80 to 85% of patients. So we are going to discuss that today. It is mainly due to the blockage in the arteries or the clot like, and hemorrhagic stroke is due to rupture or a bleed, but it is only 15%. There is one more term called a TIA or a transient ischemic attack, in which there is a recovery even after the clot has formed or there is any blockage due to dissolving of that, and again a restoration of the blood flow. Maybe the symptoms are not permanent, but still it is a warning sign. We should rush to the nearby stroke center and get well treated. Now, what are the risk factors for this stroke? It includes high blood pressures, there are no regular health checkups, or due to the obesity or increase in cholesterol levels, smoking, alcohol, there is no exercise, and even the mental health like the stress, no adequate sleep hours. This all may include as a risk factors for this stroke, and we need to prevent it. And one more thing, it is more common in old age people, but still it can come at any age, and men are more prone than women. So kindly we have to see this risk factors have been prevented. Then why the theme every minute counts? Because there are the symptoms. We had a mnemonic we use as like a code term called Be Fast, BEFAST. In that, F is for facial drooping, in which one side of face might be deviated or there is an asymmetry. When you see in the mirror, you might get a crooked smile or any weakness in one side of the face. Then A goes for arm, but also the leg. Any weakness in your arm or leg or any deviation in that, loss of power or tone might cause the symptoms of stroke. And S goes for speech. Any slurring of speech or there is no speech or blabbering in the talk, it might be a symptom of stroke. Then goes for B and E. B for balance. When you lose balance while you're walking, is there any dizziness or you're getting any vomiting kind of sensation with this, there might be a problem in your cerebellum. Then goes for E. E means your eyes. If you're having any blurred vision or a double vision, you're seeing like two people or two things, or there is loss of vision in one or both the eyes, then kindly don't neglect. It might be a symptom of stroke. In that, we are going into the last word T. T for time. Time is important. Every minute counts. So 4.5 hours is our window period or the time. We tell it as a symptom till door to needle time, where we got excellent treatment, advanced treatment with only a single drug like tenecteplase. We are getting treated. We are calling it as a clot buster. We are giving as a IV bolus treatment so that the clot dissolves and patient recovers faster. Other than that, still we got minimal invasive one. If this 4.5 hours is crossing, we are going for a mechanical thrombectomy. Even we can treat this within 24 hours by going through a guide wire through our arteries in the leg like femoral or from the hand into the artery of the brain, removing that clot faster so that the patient recovers well and soon, and there might be no rehabilitation therapies and all. For this and all, we have an excellent stroke team with a good manpower and machine power in our Medicover Hospitals, along with our fortunate, a great neuro intervention vascular surgeon who is there for us here today to treat it as fast as possible. Our pioneer, Dr. Sibasankar Dalai sir, who is the Chief of Neuro Intervention Vascular Surgeon, treating a number of cases with 18 years of experience in our Medicover Hospitals with different kinds of symptoms. Welcome, sir.
First of all, congratulations to you because you spoke about stroke so eloquently that it is very important for us, the healthcare givers, to be aware of stroke, its symptoms and the recent treatment that are happening. Once the doctors knows, automatically the knowledge is going to be propagated to the society. Hence, patients will also know, the general population will also know about stroke and its possible treatment. And I'm very thrilled to know that you have a real in-depth knowledge about brain stroke. We need to create awareness on a particular disease, which is the largest cause of mortality and morbidity in the world today, especially the morbidity point of view. This is the largest. So now what happens if you just come to the social point of view, apart from the medical point of view? Generally the stroke, which happens in men most commonly, as Dr. Sujana has indicated. Now a person who is around 40 to 60, 65 is the earning member of the family suddenly have a stroke. It is not that he only is suffering, it is the family in its entirety is suffering because of one person going out of work because of stroke. Hence, it is very important for us to discuss about stroke. It's good that we have gathered today to talk about brain stroke and its treatment and prevention.
Okay, sir, very well said now. This is very important topic, like it is a life-threatening thing which can disturb the entire family or the nation. So awareness is very important. Like very well said, sir. Day to day we see all the cases of stroke and many challenging cases you have seen. Some people are getting misdiagnosed, like thinking stroke is a heart attack. So what is the difference between this brain attack and heart attack? Can you explain us?
Absolutely, that's a good question. Now what is happening when a patient has less blood supply or cut off of blood supply to the heart, we call it as a heart attack. And the important thing about heart attack is when a patient is having heart attack, the patient will experience severe pain. And once you have severe pain, definitely you will be going to the nearby hospital. But unfortunately, in a brain attack or a brain stroke where the brain blood supply is cut off, there is no pain. Most of the time, the strokes in the brain are painless. And once you have a painless symptom going on, it is very difficult for you to reach a hospital because neither you nor the other really understand that what is happening. So it's important for us to differentiate within these two. So cut off of blood supply to the heart is called heart attack, but not stroke. Stroke word per se is fixed to explain brain attack or brain stroke. So when there is a cut off of blood supply, we call it as a stroke or a brain stroke. But cut off of blood supply to the heart is not called stroke. Although people say it is a heart stroke, it's not. It's called heart attack. So that's the difference basically. Stroke word is for brain. So if somebody says is having a stroke, means it is a brain attack or a brain stroke. So that's how we have to understand.
Very well said, sir. So it is the difference, what is a heart attack or a brain attack. Stroke is not related to heart, it is related to brain. And he explained how the blood supply will be cut to the brain and this happens. Sir, can you describe us what are the kinds of stroke we see, what are the different types and how to deal the situation?
Exactly. So there are basically we understand that the brain stroke happens because of reduced blood supply to the brain. Now, why there will be reduced blood supply to the brain? There are two major causes. We have two major blood supply in the front which goes from the heart to the brain, and we have two small blood supply from the heart which goes from the heart through the neck into the brain. The front are called carotid artery on the right and left side, and in the back we have vertebral artery on the right and left side. So if there is cut off or occlusion of blood supply in any of these blood vessel, then the effective blood supply to the brain is reduced, hence the patient experiences stroke. So reduced blood supply happens because of a blockage, number one. And number two, if there is a rupture of blood supply in the brain, that can also lead to a reduced blood supply in the brain, which is also called a stroke. So two types of stroke, one is because of blockage of the blood vessel, one because of the rupture of the blood vessel. The blockage of the blood vessel resulting in stroke is called ischemic stroke, and because of the blood vessel rupture, a stroke that happens which is called a hemorrhagic stroke. Of all stroke, 85% of all stroke are ischemic stroke, 15% of all stroke are hemorrhagic stroke. So today we are talking about ischemic stroke because it's 85% of all stroke. They are preventable and they are hugely treatable now. Because of recent medical advancements, we have got some excellent treatment for treating this ischemic stroke and reversing the stroke completely in most of the patients who can come to hospital on time.
Very well said, sir. It's amazing like how you distinguished between the ischemic stroke and a hemorrhagic stroke. So these both are not the same, and majority of patients are getting into ischemic stroke. So we are discussing this kind of ischemic stroke, and he clearly explained how the blood supply is going with two kinds of arteries, carotid and vertebral arteries. So let us not wait for this. If you're getting any of these strokes, kindly rush to the hospital. Now the theme of 2025, every minute counts. Why this theme has come, every minute counts? Is there any significance for this theme? Can you kindly explain to us, sir?
Yes, so we always say that time is brain. Minutes lost is billions of neurons lost. So every minute the brain is not getting blood supply, you lose about 1.5 million cells in the brain, which are otherwise called neurons. And the neuronal damage or death are irreversible. They cannot be brought back if you give the blood supply later. So once you lost the neurons, you lost functionality and you lost your ability of the brain. So as I said, that every minute lost, we lose 1.5 neuronal cells in the brain, which are irreversible. So hence we are very interested that a patient who is experiencing a brain stroke must come to a stroke center on time without delay. The earlier you reach, the better chance you have for a complete recovery without any further deficit in life. So please don't waste time. Every minute counts. So please come to a stroke center if you experience any signs or symptoms of brain stroke.
Very nice, sir. Extremely very well said. Amazing. Like why every minute counts? Because every minute has 1.5 to 1.9 neurons. Those are the cells in our brain getting completely dead. So the recovery, getting a complete recovery would be lost. So this is why the theme every minute is important. So if any symptoms are there, sir has said like immediately rush to a stroke center nearby, either the people around you or any family members or you itself getting the symptoms. Kindly rush to our stroke center and get treated by our neuro intervention vascular surgeons. So sir, what are the symptoms which you are telling? What are the symptoms usually you have seen in the patients with this ischemic kind of stroke?
Basically, as you have already mentioned when we were starting, so the World Stroke Organization has made a mnemonic called BEFAST, BEFAST. This mnemonic is created, basically this will help clinicians and patients and population per se to understand, remember, identify the stroke symptoms. So what is BEFAST? Basically, B for balance. So if there is a loss of balance, a gentleman who was walking perfectly fine, suddenly not able to walk, suddenly he's just putting the steps here and there like an alcoholic, you can just see the ataxic gait, then you can think that the patient is experiencing a stroke. Now after B, E is eye symptoms. Suddenly there is a dark discoloration, or suddenly you are not able to see for a few seconds, or suddenly the vision is lost, then definitely you are experiencing a brain stroke. And then F for facial weakness. A patient who was perfectly fine sitting in the restaurant, at home, at your office, at your workplace, suddenly you see that the angle of the mouth is drooping on one side, then that is called a facial weakness. So that is also a sign that the patient is experiencing a stroke. Then A for arm weakness. A patient who was perfectly fine speaking over a phone or sitting or doing his job and suddenly sees that one side of the body is becoming weak, hand, leg, or both of them, then also the patient is experiencing a stroke. And then FAS, S for speech. Suddenly I am speaking and in next moment I am not able to speak, or I have a slurred speech, then obviously you must consider that I might be having stroke. So these are the symptoms. Be fast. And T is the last thing to say you that time to rush to a stroke center. So if you have any of these symptoms like BEFAS, it's time to rush to a stroke center, because time is brain, every minute counts. The earlier you reach a stroke center, the better you chance have of complete recovery, and definitely the mortality morbidities are less when stroke is treated early.
Yes, sir. Very well said. So I am telling you people, be fit rather than going into this be fast. So this be fast has been explained very easily. So easily you can recollect what is F, what is A, S and T, so that you can rush immediately to a stroke center and get treated with this immediately. So in this be fast, now for the T for time, every minute counts. So what is this time, what is the window period, and what are the managements, different kinds of treatments we have according to the time the patient has been brought to the hospital after the starting of the symptoms, sir?
Exactly. So initially, if you just go back 20-30 years back, when a patient used to come with brain stroke, we used to give blood thinner and other medications to just take care of the stroke. But with recent advances in medicine, we have got two excellent methods to treat brain stroke. One of them is an injection, which is a clot buster. It's actylase or tenecteplase. Two different type of injections are available, which can treat stroke beautifully. Another treatment that has come, that is called a MT or mechanical thrombectomy. That is again a very excellent method to treat brain stroke because of ischemia. That is acute ischemic stroke has two beautiful treatment right now. One is an IV thrombolysis or a medicine which will do a clot bustering, and the other one is a mechanical thrombectomy. Let us dive into each of them. What is a IV thrombolysis or this tenecteplase or actylase? Now these are the injection which can dissolve a clot inside the brain, and these clots are very effective when there is a small blood vessel is clotted, giving rise to a stroke, and patient should have come to the hospital within 4.5 hours of stroke onset. So now the patient has come to the hospital within 4.5 hours. We examine, we do a CT scan, MRI, MR angiogram. We see that the patient is having a stroke because of blockage of a blood vessel, and we give this injection within 4.5 hours, and it's a fixed dose, 0.2 milligram per kg body weight. We give a single bolus and we observe. So then there is a possibility that 50 to 60% of the patient who had stroke will respond very well to this injection. Now the second method of treatment, that is MT, mechanical thrombectomy. Basically this is a treatment which is reserved for patient who has large vessel occlusion, like carotid artery block, like middle cerebral artery block, like anterior cerebral artery block, like a vertebral artery block, like a basilar artery blockage. Then mechanical thrombectomy is the first line of choice, and in that treatment we can go from the hand or the leg artery. We will reach the brain to the site of occlusion. We will catch the clot with a stent retriever or an aspiration catheter, and we'll take the clot out with a fluoroscopic guidance which will monitor us where we are and how we do it. So two types of treatment, IV thrombolysis and mechanical thrombectomy. And one major difference between two treatment, IV thrombolysis can be done up to 4.5 hours, mechanical thrombectomy can be done up to 8 hours. In some selected cases, mechanical thrombectomy can be done up to 24 hours. So these are the two different types of treatments which is available now for acute ischemic stroke, which are excellent.
Very great, awesome elaboration, sir. Now we can clearly understand what kind of treatments we have for this stroke, like two types of treatment, the TNT, thrombolysis and the thrombectomy. You have explained us in a very clear way with the different kind of arteries involved and the time how we are doing, like in 4.5 hours we are doing this IV thrombolysis, and within 24 hours we have an option of mechanical thrombectomy like sir has explained. Now it is with all the recent advances, minimal invasive, he's going through endovascular method as a neuro intervention vascular surgeon and removing the clot outside. So kindly don't neglect, kindly bring the patient fast and rush to the hospital within 24 hours or 4.5 hours, means we are getting all the medical treatment immediately available. So with a single injection you are completely recovering back to your normal life. and there is no need of any rehabilitation and support. Now, sir, a patient has come, you have done this thrombectomy. So, what are the post this procedural complications the patient might end up, or the recovery is taking time, and how is the quality of the life of the patient? Kindly explain to us, sir.
Absolutely. So, the longer the patient takes to come to a stroke center, the not so good result, the worse the result will be. The earlier the patient reaches a hospital, the earlier the intervention. That's why we always say that door to needle time, okay, and door to puncture time. So we are very, very keen on instituting the treatment early, because earlier the moment you treat the patient with a stroke, the better the recovery is. So if a patient has come late, or if already a large infarct has developed, post-procedure the patient might have slower recovery. It might not have a recovery that you expect, because the patient has come late, or there is a large vessel occlusion which was not treated well, treated with IV thrombolysis. Then those type of patients will not have a great recovery, and then for that we have to have a great intensive care unit, a great stroke care unit, and subsequently a rehabilitation unit. They all will help us to take care of these patients who come late or who did not get the right treatment at the right point of time.
Yes, so very well said, sir. Beautifully explained. Like, we have to bring them in right time so that recovery will be faster, which is available in our Medicover Hospitals, an excellent stroke team with our sir as a chief of Neuro Intervention Vascular Surgeon, who is doing both these treatments within 24 hours, so that the recovery will be fast and no need for any other rehabilitation process and all. So, sir, is there any other differential diagnosis with this stroke? Is there any other presentation which is looking like stroke but it is not a stroke? Have you seen any cases like that?
Yes. They are called stroke mimics. Means they mimic like brain stroke, but they are not actually stroke. So it could be hyponatremia, it could be because of exhaustion and because of dyselectrolytemia. So there are many different causes, but they are not very common. So 90% of the time we think it's a stroke, it's always a stroke. It's very easy to identify and differentiate because of the MRI and MR angiogram that we have. They will exactly show us, because we have different sequences like a diffusion weighted image, which will identify the stroke very beautifully. So there is no confusion about it. So there are stroke mimics because of epilepsy, because of exhaustion, because of dyselectrolytemia, but generally they can be easily identified by imaging. Clinically we may get confused in some patient, but once you do the MRI, it is not going to lie you. You will get the diagnosis right on the spot.
So here, very well said, sir, beautifully explained, like how our scans or the images, the CT and MRI are distinguishing between this. So all the symptoms doesn't mean it is a stroke. We have differential diagnosis like dyselectrolytemia, epilepsy and all. So this can be easily said by our recent investigations and the scans like diffuse weighted MRI, CT scans. So we can distinguish it easily and get treated immediately, sir. So what are the recent advances in the treatment of stroke, sir? Any new recent advances or guidelines? Is artificial intelligence, now we are listening everywhere, is it helping in treatment of our stroke patients? Kindly elaborate.
Exactly.
Sir.
So artificial intelligence is everywhere. So with your natural intelligence, if you add up artificial intelligence, definitely you are going to give a great result. So what are the artificial intelligence applications in treatment of stroke? The first thing that artificial intelligence came for stroke care in India is a rapid AI. So that is a software basically. So what it does is, for example, you do a scan and put the scan in the rapid AI software, then it will tell us that whether it's a stroke or not. It should be treated by IV thrombolysis or IA thrombolysis. If you treat, what is going to be the result? If there will be any complication, everything it will elaborate. How it works? It has taken data of millions of people, and now when you take a scan, CT scan or MRI scan, and feed it to the software, it will exactly tell whether it is a stroke or not, and what are the possibility of having collateral circulation, what are the possibility of this patient having complication after IV therapy or mechanical thrombectomy, what the good outcome you can expect out of this patient. It will extrapolate from those millions of patients. It will give you a realistic, a real life outcome of the patient if treated. Now, how it is being useful? Stroke is an emergency. 24/7, somebody has to be alert, which may not be humanly possible. Although here in Medicover, we have more than 10 consultants who are looking after stroke as a stroke team. So some of the other people are always available, but there are centers where you don't have manpower available. So treatment of stroke should be a combination of manpower and machine power. So to give a boost to the machine power, we have AI. So the software. So you don't have to have a radiologist to read the report. You do a scan, put it on rapid AI. It will give a ping to the doctor who is treating that yes, there is a stroke and I have evaluated, and by your treatment it is going to be beneficial. Then the doctor reaches the patient and does the treatment.
Yes, sir.
So the dependence on human being has reduced, and the error that could have caused by a human interpretation has also reduced. The complication can be well said to the patient if there is an anticipated complication, and the outcome also can be elaborated to the patient. So all these are happening through AI now. Further research are going on, like for example, we are doing robotic neuro intervention where you don't have to be doing. You just have to sit outside and you just have to guide. The robot will take the catheter and do a thrombectomy. And the next level of thing that is coming is a remote robotic. Suppose I get a stroke call right now, sitting here, I can give my robot instruction who can do a stroke thrombectomy there. Now robotic, remote robotics, they are not yet available widely in India or anywhere else, but they are in research stage in the US and Canada. They have done some cases, but down the line we are going to have them everywhere.
Beautiful, sir. Very recent advance and very evolved type of mechanism, sir, has explained. So this artificial intelligence, the AI, is doing miracles, but exactly like he said, manpower should be there along with the machine power, so that we'll get great results. AI is there to assist us, but it can't take over, I feel so. So it is very simple method, like through AI it is easily telling to which doctor to go, and the reports are being very faster than the normal this thing. So our stroke unit in the Medicover, we have an excellent stroke team with all this machine power and manpower. We have zero paperless, all the tech pro systems, so that immediately we can take care of this. And we have our fortunate pioneer, Dr. Dalai sir, for treating this with all the manpower and machine power and recovering the patient as soon as possible with less possible morbidity kind of.
Absolutely.
Absolutely, sir. Yes. So now I want to ask you regarding the stroke, can we prevent it? Do we have any specific risk factors for this? Any family history or genetic disorders contribute to this? Kindly explain us, sir, and elaborate this.
So yes, basically, most of the diseases, every kind of diseases are mostly preventable. And for preventing stroke, there are a few things that we have to take care. The number one, the risk factor for stroke is, first is age. As we age, we have higher risk for stroke. Second is gender. If you're a man, you have a higher risk of having stroke, which cannot be prevented. A man cannot become a woman, or we cannot regress the age per se. So those are risk factor we cannot change. But there are modifiable risk factor which can be worked upon so that you do not have a stroke, or you have a very less chance of having a stroke. What are they? Now suppose you are a diabetic, control your diabetes, get treated. You are a hypertensive, keep your blood pressure under control with proper medication, yoga, meditation. If you're an obese patient, try to reduce your body weight. If you have a sedentary lifestyle, it is better that you start moving today, because people who keeps moving have a less chance of having stroke. If you have a lot of stress at work, family, or whatever condition, you have to reduce your stress, because the more the stress, more the stroke, and you can try different techniques to reduce your stress level. And then smoking is a very, very grave cause for having stroke. If you're smoking, you must stop it right now. And excessive alcohol consumption is also a risk factor for stroke that has to be avoided. So these are the factors which must be taken care of. Less stress, good body management, proper diet, not eating out a lot, not eating out fast food, playing a game, meditation, ideal body management, manage your disease like diabetes and hypertension, and reduce your stress, smoking and alcohol intake. You will not likely to have a stroke.
Very well said, sir. It is a very fit thing for the people, like not only stroke, many other diseases we can prevent by these things. So these risk factors, like sir has explained, the obesity, the blood pressure, regular health checkups, the smoking, alcohol and exercise, and reducing, even giving importance to your mental health, have some adequate sleep and reduce the stress like sir has told. With different kind of mechanisms, we can overcome this, we can prevent this rather than going into this be fast symptoms and getting into a stroke.
So be fit rather than be fast.
Be fast, that we would tell today.
Right.
And our main theme, every minute counts. So what is the last message you want to give to the people here regarding this theme? Can you simply summarize it and tell us, sir?
I would like to say that stroke is a disease which will cause morbidity, mortality and financial burden on the family. A patient who has a stroke, if he dies, he leaves behind a lot of misery for the family also. So it's not the end of it. A patient who had a stroke but disabled, again the entire family and finances get involved for rehabilitations and other types of treatment. So it is very, very important not to have stroke. Prevention is better than cure. We might say be fast or whatever we say. We are ready to treat you whenever there is a situation like that. But I wish and pray you stay fit and you don't have a stroke. That is my wish and prayer. For that, what you have to do is you have to maintain your fitness, reduce your stress level, have a good sleep, stay away from alcohol and smoking, and maintain a good body weight, eat well, eat home food, not outside food a lot, and then maintain all other disease parameters under control, have a regular health checkup, then you are more likely not to have a stroke. But if you have a stroke, rush to a stroke center which have a good balance of machine and manpower who can take care of your stroke, where there is a CT MRI facility, there is a cath lab, and there is a possibility for IV and IA thrombolysis. You go there and get treated and get well soon if you have a stroke. Thank you. Namaskar.
Very inspirational insights for us. Really a great discussion, sir. This is really great. With all this knowledge, you are aware. So let us stay aware, let us stay healthy, happier. Let us all together beat this stroke and let us be fit rather than be fast, and let us take care of this every minute counts theme. Thank you so much, sir, for a very well discussion. So signing off with Dr. M. Srijana Devi, Consultant Anesthesia, Medicover Hospitals, and our pioneer, Dr. Sibasankar, sir, there for us as a Chief of Neuro Intervention and Vascular Surgeon, Medicover Hospitals. Thank you so much, sir.
Namaskar.